Well, Dr. Diez, I want to be talking about something you mentioned in another video, that how important a chiropractor and a dentist together are to relieve headaches, neck pain, shoulder pain, even lower back pain, simply because, well, it might start with the teeth being out of alignments for whatever reason, that they're out of alignments. And that, yes, you dentists fix it fantastic, but at the same time, the aid of a chiropractic, you even called it a movement. Tell me about it.
Well, because many of these patients come to us with muscles so tense, okay, and things so misaligned, that if we can get assistance with chiropractic assistance, we can usually get the patient much more comfortable, much faster. The chiropractors can treat the muscles, the really tense muscles. A lot of times there's a treatment called tensing the muscle, and again, it can help relax the muscle. If the spine is off, let's say that the upper spine is off, that has got to be straightened out and adjusted for the patient to get full relief. When the muscles are all tense, okay, which is resulting from the patient clenching or grinding their teeth, it throws everything off because you get these imbalances. You get one muscle pulling harder than another, and it just throws everything out of whack. And that's what a chiropractor can help us with. If we can make our appliance that helps that prevents the patient from clenching, and in conjunction with a chiropractor helping us relax the muscles, get the tension out of the muscles, and then aligning the patient properly, I mean, the result can be very quick and can be tremendous. We can turn a patient's life around. These patients that have had constant pain, we can turn their life around usually in a very short period of time.
So a patient who had a headache or muscle pains in the neck, lower back, or whatever it is, yes, especially if he has gone to a chiropractor, usually he perhaps did experience some relief, but it kind of keeps coming back. And everybody knows that just isn't natural, and it's not true that we just get old. He should also visit a dentist because maybe there's some misalignment with the teeth, and then you together, or like if you get a patient in with it, it looks like you're referring them to a chiropractor quite frequently in order to get all that straightened out and to get a synergy going.
That's right. What the chiropractor is treating the patient's symptoms, and that's great. But like you said, sometimes the source is something else. And the same goes for me. A lot of times I'm treating maybe the source of the problem, but because the patient's had the problem so long that there are problems, that there's issues there.
There are multiple. There are multiple. From one source becomes multiple sources, basically, right?
Right. And unless I have assistance from a chiropractor, I'm not going to be able to totally correct the patient. So, again, we work together.
Right.
And together we can usually make the problem.
Right. Well, because chiropractors as a whole are coming much, much, much closer to handling the source than just about any other medical doctor who gives medicines and whatever. Because the headache isn't in the head.
it's coming from somewhere else.
It's in the lower back, in the upper back. It's in the teeth. It's coming from somewhere. And if you leave it long and like a rotten apple, after a while, it's not one rotten apple. It's several rotten apples. And
that's right.
Yeah. Good.
You're absolutely right.
Well, wonderful. So there is hope. I hear that like some cruciating pains in terms of migraines and stuff have been alleviated by going, to get DMJ treatment, and in your case, also a chiropractic treatment, kind of the, two specialists together.
That's right. That's correct.
Good. Wonderful. It's good news. Thank you very much. Bye-bye.